Welcome to the Polyvagal breathing practice series. In this series, we're exploring an aspect of the vagus nerve and partnering that with a breath practice. In this video, we'll be working with Dr. Stanley Rosenberg's basic exercise, exercise 1. You'll find that in this great book, Accessing the Healing Power of the Vagus Nerve. I love this book. It goes into all the science, gives you lots of tools you can use at home to enhance your social engagement and also your overall health and your body's capacity to heal. Exercise 1 enhances social engagement by 1, bringing more oxygen into the brainstem. And all 5 cranial nerves that support social engagement originate in the brainstem. It also supports alignment for upper cervical, C1 and C2, the atlas and the axis. And that alignment is critical for the state of social engagement. As we're getting started, let's go ahead and you can just do a little before and after. So see how you're doing before and after the exercise. And in the before, just go ahead and look to the left as far as you can comfortably and notice if there's any pain and tension. And then look to the right as far as you can comfortably. Notice if there's any pain or tension. Dr. Rosenberg recommends that you do exercise 1 laying down on the floor so you can feel the weight of your head in your hands. And then eventually you can do it seated. We'll start seated just because we're here together. So go ahead and overlay the fingers, lace the fingers together, and then place that on the back of your occipital lobe, and you can just feel the weight of your hands on the floor, the weight of your head in your hands. Right now, just that nice little stretch there. And then we're just going to take 60 seconds and look to the right. So the exercise overall is 30 to 60 seconds each way. So we'll go ahead and look to the right with your eyes only, so keeping your head still. Look to the right as far as you can and breathe. And you might notice there's a time where there's a deeper breath or a yawn or a sigh, and then look the other way. And to the left for another 30 to 60 seconds, or until you feel that deeper sigh or yawn. And then come back to center. So I just wanted to show you the hands on the back of the head so you can get a visual for that. It's just supporting that occipital lobe, occipital ridge right there. So now the after test. And go ahead and look to the left, see if there's any changes. And look to the right and see if there's any changes, and notice if there's changes in other places in the body. People are often surprised at the level of change. So this exercise is just 2 minutes. I do it right before I fall asleep. The other aspect of the eyes that I attend to is the nasal visual field, because we're so over-focused on the nasal visual field right now. So focusing narrow towards our nose with all our devices. And so releasing that before I sleep at night. And so to do that, focusing the eyes on the point that's between the eyebrows right here. And this point is also involved in like perceiving light and dark, setting circadian rhythms. And so it definitely has an optic chiasm right there, the supraoptic chiasm. So go ahead and focus there for a moment. And just that sense of relaxing the eyes, just with an easy gaze, focusing on that point. You can do it with your hand there if that feels good, or just sitting. So there are modalities that access the eyes as a healing modality for healing trauma and helping support the body and coming back into ease, such as EMDR. And so these are just 2 very simple exercises that you can do at home every day to support both all of your cranial nerves, but also your visual field. So I hope this video also inspires you to learn more about the vagus. It's just really central to your health. It's a pillar for your health. That and the breath together are both pillars for health. So enjoy your practice, and I encourage you to try exercise 1 for a couple weeks and see what happens. Take care.